So far, I'm really enjoying it. So I've been here 1 year now exactly. I would say it was a bit of an adjustment, not at all like normal practice, different in a number of ways. So this little kitty was out in foster care and came back with a head tilt and a very severe, well, actually double ear infection in both ears. It's improving already. All right, my sweet. So this little one is doing much better. We'll keep her another day or two before sending her back into foster just to make sure that her fever stays down. But she's doing well. The first thing that I noticed, and I think my brain had to kind of adjust, was the unscheduled. You know, nothing is scheduled here. You don't know what you're going to see. Oh, ouch. Yes. And this one, he has a hematoma, but it's already organized, like it's firm. And that's the right. Oh. So we're going to do a little cleansing of the ears, and then we're going to start some medication, but we will look at a stain slide to see what the population is in that ear. Is it yeast? Is it bacteria? Is it both? Are they rods? Are they cocci? And then we can decide how best to treat. He's probably an allergic dog. I'm glad that I worked in general practice before coming here. I think you really need a good, solid background in clinical work before working in a place like this. I haven't seen the cat yet, but our technician has already examined her, and the cat was given some pain relief and started on some antibiotics. So I'm going to take a peek at her now and see what we can see. So this is what you call a severe case of mastitis. Probably started out as mastitis, and now we've got abscessation. Now I'm doing this now because it may be a while before I can get her sedated. Does it look better to you from yesterday?
Yeah.
You're not always in the confines of an exam room. In fact, most of the time you're not. Like, you might be doing an exam on the floor, out in the waiting room, or some other place in the facility, and you're constantly looking for the supplies that you need, that kind of thing. So that was a big adjustment to me. It's kind of my first thoughts were, this is like trench medicine. You know, that's really what I thought. You can see that's an extremely painful. I got the front one little thing. Probably want to get her temperature again. Okay. As well, the things that we see here, although they're very similar to what you'd see in practice, is it seems there's several degrees further along. So you don't just see bite wounds or, you know, wounds from a hit by car. There'll also be maggots. Or perhaps you'll see a fracture, but the fracture has likely been there for a week or 2 weeks or maybe longer. We've got some drainage from the surgery site. Now, I saw this kitty on Monday and it looked very dry and clean, but it doesn't look that way now. So what I'd like to do with this is swab it and send it for a culture because she is on antibiotics. We don't always have everything that we need or all the things that I would like to have because we're a non-profit organization. So everything that we use, everything that we have, basically we've bought that through donations. And sometimes we'll have a full cupboard of things and sometimes we won't. And so you just have to do your best. And as well, you know, we can't do a lot of advanced diagnostics very often. Sometimes we can, but sometimes we can't. I think we do a good job in certain things. You know, if a kitty or a dog has a broken leg, we generally can take care of that. We've got people that will help with that. But things like chronic diarrhea, that can be a real drain, trying to sort that out. So I'm gonna make a little, just a direct smear of this stool, just to see if I can see anything obvious like coccidia or giardia. This kitty's been with us for at least a month. The stool, you know, it gets a little better and then it gets really runny again. So that's, you know, we can't adopt a cat out like that. He's an exceptionally nice kitty. Also very, very beautiful. And I know somebody is going to love this kitty a lot, so we want to get him healthy if we can. Of course, being here in the shelter setting is very stressful, so it could just be, you know, IBD. I suspect that it is. So this is what happens. You do one thing and then you get pulled away to do another. And that's normal. That's what we do. Yep. Your temperature is normal. Okay. So yeah, I'm not worried about it. Everybody in this room has been treated for an upper resp. So they're all together because they were all sick. But he is persisting with these sore-looking eyes. He's being treated with doxycycline. Mid-October, he was on isothal ointment, which did not do much for him. And he started erythromycin on the 22nd. Today's the 24th, so this is the third day with erythromycin. And it doesn't look like there's much improvement, so... Yeah, so this is probably a stressy kitty, right? It's probably herpes virus. If I had some famciclovir, I'd probably start that because I think that does speed up recovery, but I don't have any, and it is back ordered. It's also very expensive, so we can't always afford to have it here, but I do like to use it in the kitties that are, you know, the worst. Because I'm drawing some blood because his mucous membranes look pale. And so we're going to do a leukemia FIV test and possibly a CBC. We're doing the best that we can with what we have. And we're seeing a lot of animals every single day coming through here and trying to get them into good homes.